Hello and welcome to cjmeds. Today's topic is atrial fibrillation. In atrial fibrillation, the heart's upper chambers, that is the atria, beat out of coordination with the lower chambers. This prevents blood from flowing into the heart's lower chambers, that is the ventricles. As a result, the heart doesn't pump blood as efficiently as it should. Atrial fibrillation is a common heart rhythm disorder. It affects about 2.7 million adults in the United States. Atrial fibrillation can occur at any age, but it is more common in older adults. There are several things that can cause atrial fibrillation, including a heart condition you are born with, that is a congenital heart disease, which is also the most common cause, high blood pressure, coronary artery disease, sleep apnea, thyroid disease, excessive alcohol use, stress, and smoking. Atrial fibrillation usually doesn't cause any symptom, but you might feel heart palpitations, which is a sensation that your heart is racing or skipping a beat. You might also feel short of breath, fatigue, or chest pain. If you have atrial fibrillation, you are at a risk for stroke. That is because blood can pool in the heart and form clots. If a clot breaks free and travels to the brain, it can cause a stroke. Atrial fibrillation can also lead to heart failure. That's because the heart isn't pumping blood as efficiently as it should. There are several treatments for atrial fibrillation. These include medications that control the heart rate, example beta blockers, calcium channel blockers, etc. Medications to prevent blood clot formation, for example anticoagulants. Cardioversion, which is a procedure to shock the heart back to its normal rhythm. No need to worry, as it uses quick and low energy shocks to restore a regular heart rhythm. Catheter ablation, which is a procedure to destroy the areas of the heart that are causing the abnormal rhythm. If you have atrial fibrillation, it is important to see your doctor regularly. You will also need to take steps to reduce your risk of stroke, such as taking blood thinners and managing any underlying health conditions. If you find my video useful, please do like and subscribe to my channel. Thanks for watching.